Rounded shoulders and a tight chest is one of the most common muscular imbalances that I see in pregnant and postpartum bodies. Today, I'm going to take you through a few stretches to help find some release there. First thing I want you to do is a stretch that we all know. You're going to take that arm out to the side, pull it across your body, pull your ear away from your shoulders. So you're just going to slightly take your opposite hand and slightly pull that back towards you, feeling that stretch through your arm and your shoulders. You're going to hold this for 30 to 45 seconds. Take a few deep breaths, practice that diaphragmatic breathing. Then you're going to take that same arm out, drop it behind your head, take that opposite arm to your elbow, and then just lightly put a little bit of pressure there. Again, diaphragmatic breathing. Stay nice and relaxed through the lower belly, through the pelvic floor. 30 to 45 seconds on this side. And then open that back up. We're going to take it over to the other arm, pulling across your body. Pull that shoulder away from your ear. You might notice that you've got tightness more on one side than the other. Gentle pressure here, pulling back towards you. And then open it up, drop it behind. Opposite arm grabs it. Try not to crunch the back of your neck. Nice deep breaths. Check in with your pelvic floor. Are you lifting and gripping, or can you find a little bit of a release there at the bottom of your body? Good. Now just take a few shoulder rolls up and back, and then go the opposite direction. And then I want you to take your shoulders, I want you to inhale, squeeze them up to your ears, and then exhale, feel them lengthen and press down your back. Take that 2 more times. Inhale, lift. Exhale, lower. You should feel that scapular engagement when you come down. 1 more time. Inhale, lift, and exhale, lower. Now this one's to release those pecs. I want you to take your fingertips and imagine where your bra line hits right here on the sides. You're gonna take those fingers and you're gonna dig them right into that place where it might feel a little bit tender. Then you're gonna take that opposite arm with some gentle circles, and the tighter your pecs and chest are, the more uncomfortable this is gonna be. So you're just trying to feel that release work right here as you take that arm around. Go 1 more time in this direction and then reverse, go the other way. And you can kind of move your fingertips around here to find the spot that feels the most tender. If you push too deep, you might get some tingliness in your fingers. Try to just, stay out of that sensation, scale back a little bit. Then you're gonna take arm across your body and open. Same thing here, just a few times, forward, back, open, and close. And then you're gonna head over to the other side. Maybe give yourself a little self-massage there before you go. Fingertips right there. Think about where your bra hits, and then big circles up, around, and back. Diaphragmatic breathing, pelvic floor relaxing. These are all reminders that I know I need. And then switch, go the opposite direction, back to front. You might feel a little bit of popping. Play with your range of motion. If it feels like it's popping or grinding, maybe make a smaller circle. And then open and close, holding that pressure right here at the front of the body. 1 more time. Good, and then give yourself a little self-massage there. Great, again, shoulders up, down, and back. And reverse it. We are gonna come into an all-fours position, and we're gonna thread the needle to help open up the shoulder. So from your position here, I want you to just take 1 arm out to the side, thread it underneath, so you've got your pressure down on your shoulder. And then I want you to feel that stretch happening on the back of that shoulder that you're down on, and I want you to just take some nice deep breaths into it. Full belly breath. Just hold here for a few more seconds. And then we're gonna switch over to the other side. I'll turn around here for you. We're gonna come onto all fours, take that opposite arm out, and then down into your shoulder. Again, you may feel tightness more on one side than the other. And when you find that shoulder's that's a little tighter, just stay here for a few extra breaths. Relax the pelvic floor. Feel those sits bones widen, lengthen. 1 more breath here. Good, and then I want you to come all the way down to your side. So down into that side lying position. You can fold your knees underneath you. You're gonna stack your arms. And then I want you to use your core belly pump for this one to protect that rotation in your spine, especially if you're pregnant or newly postpartum. You've got a little bit of abdominal separation. We're gonna exhale as we head into a little bit of a thoracic twist. Just because we don't want to twist and push out on those abs, we want to hug those abs close to us. So this is to open up those chest muscles. But I'm also lifting through my pelvic floor and hugging either your baby or that belly back towards you as you go through this stretch. And you're just gonna hold here, deepen through that pelvic floor, wrapping in the core, and then we're gonna head over to the other side. So press yourself up, use your breath, keep using your breath to get yourself down to the other side. Take those arms out in front of you, fold those legs underneath you. Take a nice big inhale, relax the pelvic floor, release the lower belly. Exhale, lift through the pelvic floor, wrap those lower, middle, upper abdominals towards you as you hold this open. And because of pregnancy and early postpartum, you don't want to go into that full thoracic twist where you take this arm all the way to the ground. Just lift it up as far as you're comfortable and maybe to about 45 to get those chest muscles to open. And then use your exhale breath to bring yourself back together and back up to sitting.